Welcome back to another edition of The Explainer. I am so incredibly thrilled you're joining me today because we are diving into something absolutely fascinating. The dynamic, rapidly evolving world of dentistry right here in Pakistan. If you've ever even briefly considered a career in healthcare, or maybe you're just kind of curious about how the pros who keep our smiles bright actually learn their craft, well, you're in the perfect place. Today, we're going to completely map out the entire dental ecosystem. We'll look at the professional pathways, the data, and figure out exactly how this industry functions from the inside out.
Okay, so let's just jump right in. Here's our roadmap for today. We'll start broadly with the world of dentistry, then look specifically at the dentistry scope in Pakistan. After that, we'll be exploring professional pathways, and finally wrap up with what I like to call the dental dream team.
All right, Part 1, the world of dentistry, understanding the basics of oral healthcare.
So, by definition, dentistry is the branch of healthcare that focuses on the diagnosis, prevention, and treatment of diseases affecting the teeth, gums, jaws, and the entire oral cavity. But let's read between the lines a bit here. This isn't just about, fixing a cavity. It's an essential field that brilliantly combines rigorous science, cutting-edge tech, and really compassionate patient care to drastically improve a person's overall quality of life.
Because honestly, modern dentistry goes way, way beyond just pulling teeth. It encompasses everything from deep diagnostic work on oral diseases to the active prevention of dental problems. It involves complex treatment, restoration, and rehabilitation of teeth and gums. Plus, there's the highly in-demand area of cosmetic dentistry, and perhaps most importantly, patient education. It's a true, full-spectrum medical discipline. Moving right along to Section 2, Dentistry Scope in Pakistan, we're seeing some rapid growth and really diverse opportunities here. For any prospective students tuning in right now, you need to know that a career in oral health in Pakistan doesn't just mean opening up a tiny corner clinic. The scope is genuinely massive. You could be working in major government hospitals or private dental clinics. You might find yourself teaching at dental colleges and universities or conducting groundbreaking work at research institutions. There are huge opportunities in specialized dental laboratories, shaping policy with public health organizations, or even serving in the Armed Forces Medical Services. The pathways are just incredibly varied. And what's really exciting is that the field in Pakistan is modernizing at breakneck speed. We are seeing a massive surge in digital dentistry, specifically utilizing CAD/CAM systems for computer-aided design and manufacturing. Throw in the explosive growth in areas like implantology, orthodontics, and cosmetic dentistry, and it's clear the doors are wide open for advanced studies and international opportunity. Which brings us to Section 3, exploring professional pathways, finding the right role in the dental ecosystem.
So I want to pose this question directly to you right now. Which pathway is right for you? Do you want to work hands-on, directly with patients, or you may be more fascinated by the high-tech engineering side of things? Well, let's break it down.
Let's kick things off with our first major pathway, the Bachelor of Dental Surgery, which you'll usually just hear called a BDS. This is a rigorous 5-year academic and clinical commitment. And once you graduate with that BDS, your primary workplaces are going to be right in the action. Think active clinics, busy hospitals, and universities. Essentially, a BDS dentist is your primary point of direct patient treatment. They are the ones handling the real heavy lifting. We're talking examining patients and diagnosing complex oral diseases, performing fillings, extractions, and root canals. They are the ones placing implants and executing actual oral surgeries. Plus, they prescribe the necessary medications and map out those overarching treatment plans. Basically, they are the clinical leaders of the whole operation. Now, let's pivot to our second pathway, which is the BS in Dental Technology. Now, this one is a 4-year degree program, and the environment here shifts pretty significantly. Instead of being chairside working directly with a patient, dental technologists are typically based totally behind the scenes. You'll find them in highly specialized dental laboratories and sometimes in university or hospital workshops.
I actually really like to think of dental technologists as the engineers of the mouth. They literally take the prescriptions and the blueprints created by the dentist and they bring them to life. They fabricate complete and partial dentures and custom manufacture crowns and bridges. They produce orthodontic appliances and create implants and prostheses. And they're doing all of this using that cutting-edge CAD/CAM software and 3D printing we talked about earlier. It is an incredibly technical, absolutely vital role.
And that leads us to our third major pathway, the BS in Dental Hygiene. This is another intensive 4-year degree, but notice the shift in the workplace here.
While they absolutely work in clinics and hospitals, you're also going to prominently find dental hygienists in schools and public health centers, deeply engaged directly with the community.
Think about it like this. If technologists are the engineers, dental hygienists are the frontline defenders of preventive healthcare. Their entire focus is heavily geared toward preventing gum disease and other issues before they ever require surgery. They perform critical scaling procedures, teeth cleaning and polishing, and apply fluoride. But a really massive part of their job is actually oral health education and counseling, basically teaching people how to maintain their smiles so they don't end up in a surgeon's chair in the first place.
When we take a step back and put these three pathways side by side, the unique dynamic of this whole ecosystem becomes super clear. You can see that dentists and hygienists share that direct patient contact, while technologists remain entirely behind the scenes doing laboratory work. The dentist acts as the architect, prescribing a treatment and performing surgeries over their 5-year training. The technologist, with their 4-year degree, acts as the builder, fabricating the prostheses. And the hygienist, also a 4-year degree, acts as the protector, focusing on prevention and maintaining tissue health. They are completely distinct, yet totally complementary.
All right, finally, Section 4, the Dental Dream Team. Let's see exactly how these roles interlock for patient care.
Let's actually see how this plays out in a real-world scenario. Imagine a patient arrives at the clinic in severe pain. That's step 1. Step 2, our BDS dentist steps in, diagnosing the issue and deciding, let's say, a custom crown is needed. That blueprint immediately gets sent over for step 3, where the dental technologist uses 3D tech to meticulously fabricate that exact crown in the lab. The dentist places it, but the journey isn't over. Step 4, the dental hygienist takes over, providing the ongoing scaling and education to ensure the gum tissue around that brand new crown stays perfectly healthy. And the result? Step 5, a fully restored, happy patient.
And I think that brings us perfectly to the core message of our explainer today. Together, they create healthy smiles. Dentistry in Pakistan is this rapidly expanding universe of clinical practice, high-tech laboratory science, and community-driven preventive healthcare. No single role can do it all alone. So as you look at this booming medical ecosystem and all the incredible advancements happening right now across Pakistan, I want to leave you with one final thought to ponder. Out of all these options, which vital role in this dream team are you going to step up and play? Thanks so much for learning with me today, and I'll see you in the next one.